Atlantic Health Systems, home of Atlantic Sports Health, with Doctor of Physical Therapy, Joseph Shadowski. And Joe, I know you have a great background in helping rehab post-surgical ankle injuries and just rehabbing injuries of the foot and ankle. Talk to us a little bit about, first yourself, your background a little bit, and then dive into rehabbing ankle sprains and different ankle injuries. I think it's really important, foot and ankle, that kinetic chain. If something's not fully rehabbed, it can cause so many other issues up that kinetic chain.
Right. I've been a physical therapist for 10 years, specializing in orthopedics. I've been with Atlantic Health for 2 years. My main interests are working with athletes, post-surgical patients, and I have an interest in also strength training athletes, powerlifters, strongmen, and Olympic weightlifters. When it comes to the rehab process for ankle sprains, there's a few things that you have to consider. One is the where they are in the healing process. So if it's early on, there's a emphasis on controlling pain and swelling. And so when these patients come in, we want to focus on redeveloping range of motion, controlling the pain and swelling, and also starting to gradually mobilize them so they can start to bear weight on their ankle. From there, the process would progress to more emphasis on strengthening, things like squats and lunges, and things to develop control and ankle stability, in addition to manual therapy techniques to continue working on that range of motion.
Yeah.
Another big part is balance training. We want to work with things like balance boards and foam and things that are going to challenge the balance in that ankle so it has to stabilize and control. And from there, then we begin to develop, we start to progress back towards a sport-specific training. So that's going to be your typical plyometric training, hopping, running, agility drills. The key there being that the patient is going to want to be 100% pain-free. In this way, they are fully prepared to return to sport. Yeah.
I think there's a fine line to when an athlete injures their foot or ankle, you mobilize it. When does that point become where you start to get immobilization?
It can happen pretty rapidly, especially when a patient has been put into, say, a cast or a boot, which is why we want to promote that movement early.
Right.
Otherwise, once they stiffen up, it drags the process out and makes it more and more difficult to progress them towards the things that are going to get them back to sports. So that's why there's a major emphasis on early mobilization. So we want to see these patients come in pretty early and begin to get them working at least in safe, gentle conditions initially, and then progressing to their tolerance.
Yeah. I think, again, sometimes athletes, they might be in that boot too long, right? And that causes an issue where, it starts to lock up. And having the right therapist, developing the right protocol, making sure you're going through a full range of motion, working that ankle, working that injury, so you can get back, sooner than later. The other side of the coin, too, athletes coming back too soon, right? And then re-injuring. I know the statistics are very high for ankle injuries happening a second time.
Correct. The greatest predictor of a future ankle sprain is a previous ankle sprain. So these are usually athletes who maybe did not complete the rehab process to its fullest, or there wasn't good symmetry between the uninjured leg and the injured leg, and they return too quickly, and then they can end up with either a chronic ankle sprain, and then in possibly severe cases, they may end up rupturing the ligament, and that may require surgery.
Wow. What would be the one or two things you can tell a parent, an athlete of a kid that has an ankle issues? They're just they think they have weak ankles, right? Or the ankle itself isn't weak. The muscle, the structure, the proprioception around the ankle causes limitations. What can you share with people that are just battling with just ankle injuries right now that might not be seeing a therapist?
The most important thing is they need to come in for an evaluation so that we can identify where the impairments are and why this continues to happen. That is the most important thing with regards to possible future re-injury or worse injury. So if they come in for an evaluation, then we are able to identify why this continues to happen and then set up the appropriate clinic program and home program so that they can take ownership of improving the strength in that ankle and have it be better prepared for the demands of their sport.
And I think, it's all comes back to education, right? It comes
Correct.
back to learning some techniques, some rehab strategies, some techniques which we're going to talk about on the future segment that you can do, at home that can make a world of difference in that stability. Thank you so much, Joe. I really appreciate the time, the information, and look forward to gaining some more on our next segment.
Thanks a lot, Bill.